Hi, I'm Dr. Catharine Goodson, founder of Medical Emergency Mastery. I teach dentists and their staff how to recognize and manage medical emergencies that occur in their practice so they can best protect their patients' health and safety. The American Dental Association states that 1 in 10 dentists will experience a medical emergency each year in their practice. That equates to 150,000 medical emergencies each year in dentistry. The majority of us think two things. Number one, that this could never happen to us, and number two, that we are prepared to handle a medical emergency for the 5 to 7 minutes that it takes for responders to arrive. I too thought those things, and I was wrong. My medical emergency occurred when my patient experienced a life-threatening asthma attack. In the ensuing aftermath, I was forced to look at my part in the development of the emergency. What I found were 3 key factors. Number one, my medical history did not ask the type of questions in enough detail so that I could make an excellent decision regarding my patient care. Let's face it, the medical history is the first and only form that we have to decide whether we are willing to do the dental treatment on the patient and whether we want to invite them into our practice. Doctors, once we establish the doctor-patient relationship, it is extremely difficult to terminate. Number two, my emergency drug kit had far too many components in it that I was either not qualified or able to use in a moment of crisis. And the third thing is I believed erroneously that my cohesive team was able to handle an emergency. Many of us have teams that have been together for many years, and my situation was the same. I determined at that time that I would do my best to never have this occur in my practice again. Medical emergency was developed out of that desire to be able to handle any medical emergency and the knowledge that this information could not only benefit me, but could be of benefit to the profession. So this is what I did. First, I evaluated the medical history and determined that for my needs, it did not ask enough information about enough systems in enough detail for me to be able to make an adequate assessment. So what I did was redesign the history to contain a systems-oriented approach. So all the questions about asthma are listed together, allergies together, cardiac issues together. We all know that the majority of the medical histories that we use are from stock companies or are on our computer system. So the number two thing that I did is I evaluated my emergency drug kit. What I found in there were components that I wasn't qualified or able to use. So I removed all the emergency drugs, packaged each one individually, and labeled it not only with the name of the drug in the dental term and the layman's term, the uses for the drug, and the directions for use. So after doing so, my drug kit had only the components that I was qualified and able to use, with instructions in a concise manner that were understandable by any team member in the event of a crisis. And the third thing I did was I delegated specific staff roles for each of my staff members. Now, this system can be implemented with a staff as few as 3 members. What I also did was I developed an emergency maintenance list, so it allowed me on a monthly basis to review each emergency and make sure that my staff was current and knowledgeable, because you know from time to time you have new team members and you're concerned about how you're going to train them in all areas of dentistry, but most specifically emergency preparation. I developed a spreadsheet that allowed me to be certain that my emergency drugs and equipment were up to date and were available in one area of the practice. I also developed the contents of an accurate and adequate 911 call, as well as the means for the doctor to document an incident after it occurred. So after developing these systems for myself, I began to share them with my friends, and they all said the same thing. We don't have a system in place to prepare our staffs. So medical emergency mastery was developed for general dentists to allow us the ability to look at the systems that we have in place. If they're adequate, then this can be used as a supplementation for what you already have. But I think you'll find if you review these 3 areas that those are areas we all struggle with. So if you think this is something that would benefit you and your patients, I'd be happy to provide you with a complimentary medical history that you can use to review the systems that are present in your medical history now and to possibly supplement what you already have. If you'd like more information about that, please leave me your name and email in the box to the left, and I'd be happy to get it to you immediately. Thanks so much for listening to this information, and I wish you all the best in the world's best profession. Thank you so much.